Hey, good morning. Welcome to my home. So I'm doing a quick vlog from my room today. So this is, Daryl's got his own room, basically, that way, down the other side of the house. And this is my room. Now, if you ask any of my friends, and probably family as well, they'd probably say this room is just typical of me, really. It's kind of, God, what would you say? Old lady-ish? Look, this room is full of memories, and it's me, it's my personality. It's different things. You can see behind me, I've got Molly on the wall, I've got the Queen on the wall, I've got loads of different things going on. But this is my space. This is my, what do you call it? My safe space, if you like. And it's where I feel most relaxed. So it seems to be down to the ground. And Daryl's got the cats and the cat trees and all the muddle and the mayhem down the back of the house. So there you go. First update, I just want to update you on the book. So I am in the process of finishing now, and it should be, when it's ready and available to buy, I will let you know. And I've decided to call it, it's called Echoes in the Hallway. And it's really about, I suppose you call it echoes from my childhood. So it's short stories based around my childhood in the 70s and 80s, and it's all about me growing up and the memories that I hold from that time. Now, I think my earliest memories, I'm going back to like 5 or 6 years old, the Silver Jubilee as well, around that sort of era. Funny enough, I don't remember much before that, and I don't think many people do anyway. So, you know, it's a, what do you call it? It's an honest appraisal of my childhood, my wrestling with sexuality, especially at an early age. I mean, I realised I was gay when I was 11, so there's all that in there as well. There's lots of different elements, and obviously about my mother and father and maternal and paternal grandparents. So I like it. It's me. It's a memory for me more than anything. If you remember me from school, you'll find a lot of what I've written about is very very important to you as well. There's probably a few memories in there that you can relate to. So I will let you know how it goes. So today I want to talk about heart murmur. God. Daryl was saying to me that, look, I've been in Australia now for 3 years, and me and Terrell were talking the other day, and I mean, ever since I've been there, I've just been going like that way. Friends have said to me, you need to come home, and get well and all the rest of it. Look, I live in Australia now. This is my home. So they're taking good care of me here in many respects. Let me explain. I've had lots of things going on, from biopsies to, gosh, what else did I have? COVID recently. Lots of different procedures I've had to get done and all the rest of it. But you have to bear in mind, I'm 55 years old. So things are not going to work in the way they used to. Probably never worked in the first place, to be honest with you. Anyway. Now, the latest was I had chest pain. So this is last week. I had chest pain for several days, and it's unlike me to deal with something immediately, but I sort of kind of left it, and I thought it will go away and it's not a problem. And anyway, I got to work on Saturday, and the pain was horrific. It was really, really bad. And it kind of started in the middle of my chest and it worked all the way around here. And it went round to my sort of left shoulder blade. And I thought, this is not normal at all. So, bless her heart, one of my casuals, I just had to say, look, I've got to go to hospital. I will make sure somebody comes in to be with you ASAP, but I've literally got to go to hospital. I've got chest pain. So they were quite concerned. I mean, obviously I was quite concerned. And I went to hospital. Midland, St John of God Hospital. I got there. Everything's triaged through computers now, so you've got a touch screen and you just type in all your details and what's going on with you. And they were there within seconds, and they took me through in a wheelchair. Straight through. There was no waiting, because usually if I'm in ED, I'd be waiting, God, good 2 or 3 hours, but no, I was taken straight through and wired up, literally. So I got there, they shaved my chest so they could get all the stuff for the ECG, everything. They were monitoring me straight away and taking good care of me, to be honest with you. Naturally, my anxiety was sky high, and I didn't quite know, how can I put it? I didn't quite know what was going on, although I kind of know the procedures, what happens if, somebody's having a suspected heart attack. They will, they do all the things that they were doing. And I had a lovely nurse looking after me who come over with a consultant, and she listened to my chest and she listened to it again, and she kind of shifted me into different positions. She said, can you just move this way and that way and all the rest of it? So I did. And she said, okay, I'm going to leave you for a bit. So they left me for a bit. Got me something to eat, actually. And I did the ECG, they did the blood pressure, they did all that stuff. They did lots of blood tests. Now, blood tests for me really don't mix at all. I hate blood. I hate anything to do with it. And she couldn't, well, she could. I don't, if you're going to take my blood, don't give me a run-on commentary of what you're doing, because it makes me feel quite ill. So she took blood, and she went, she said, I've got a bit of blood. And I kind of looked at the corner of my eye, because usually I shut my eye, and there was quite a lot of blood, to be honest. And it makes me feel faint. So I thought, this is not good. And she said, your veins moving about. And I thought, whatever that means. She just said, you're obviously quite well hydrated this morning, which I was. And anyway, I just didn't want to know the ins and outs of what she was doing. Just get the bloody thing in my arm, and that's it. She put it right on the bone as well. And it hurt. And I'm not good with pain. I'm not good with anything health related. I'm really not good with. So anyway, did that, took blood, sent them off. And she kept coming back. They were monitoring my blood pressure. They were doing all those things, my blood oxygen levels, everything. And eventually she came back and she said, look, we've had your results through. They're fine. ECG, fine. But she said, you got, she called it a systolic heart murmur. And she said, look, don't worry about it, really, at this stage. She said, a heart murmur can be benign or not. And she said, have you always had a heart murmur? And I said, I've never had a heart murmur as far as I was aware. Now, alarm bells started to ring in my head, because she said, is there any genetic heart problems in the family? And I said, well, my paternal grandmother had a heart attack. She had several heart attacks, and she eventually died of one. My mother also died of a heart attack. So those were the alarm bells that were ringing with me and her. But I remembered my father actually said to me that Mum had a heart murmur. And she was diagnosed at probably about a year and a half before she died. And that was really concerning. Now, they said at the time it's nothing to worry about, and they didn't do any further tests on Mum. And kind of what this lady was saying, she said, look, it's generally nothing to worry about, but in 90% of cases, there's nothing to worry about. But, you know, there is that chance that there could be something going on. And so I sort of, naturally inquisitive, asked her, well, what? And she mentioned two things. So she said there could be issues with the valves, and they said the other one was a narrowing of the arteries, both of which are treatable. And I would have to be referred to Royal Perth for that. And I said, oh, okay. And she said, you will need to go back to your doctor and you will need to get, I don't know, looked at, checked, because he needs to listen to my chest again. I mean, what she did say, she said, he may listen to my chest and that murmur may not be there anymore. And I said, what, it can disappear? And she said, yes. She said, I explained that I was an anxiety-ridden individual, and she said, look, anxiety can bring on these things. She said, I'm not saying it is, but it can. And then I sort of asked her about COVID, because I just had COVID. Could that be responsible? And she said, look, she didn't want to comment. She didn't know. She said there's stuff being looked at in that area, but nothing that she could confirm or deny with me. And generally, there's not anything to say that COVID causes a heart murmur, to be honest. So there's lots of unanswered questions, and all before I just go on holiday, which is really, really concerning for me, because the last thing I want to do is have to cancel my holiday. But I need to see what's going on. I mean, he may listen to it. He may say it's completely innocent. She said you will be referred for at least, she said, an echocardiogram, whatever that is. But she did mention something called an angioplasty as well. So I don't quite know what that is or what it entails. I believe it's a dye that's put through your brains to see if there's any narrowing or whatever. I don't know. I'm not a doctor. The only doctor I have is Dr. Google, and he's generally, not my friend. He's most definitely my enemy. So yeah, I've had a bit of a traumatic week again, and it doesn't seem to be getting any better. And I'm guessing it is my age, and this is the anxiety-inducing thing for me. I've done vlogs and blogs about anxiety in the past and how it sort of came about, and watching Mum die in hospital, and my great aunt died of cancer, and the variety of different things happened, and I seem to have become this anxious individual. And I know, because the doctor and nurse said to me, that anxiety is really, really bad for you, and you need to deal with the root of that problem, and you need to deal with the anxiety. So I'm going to see a doctor on the 30th. I probably should have seen him a little bit before, but I wanted to just give it time just to see if anything calms down and possibly goes. So I understand that anxiety is one of the biggest problems at play here. But I don't quite know how to deal with it, and I know there's all sorts of medications and that available, and it's just something that I've got to deal with going forward. I've literally got to deal with it. Now, at the moment, I'm fine. I feel fine. I feel okay, and I do. What is it? I do have a bit of nagging. I do have a little bit of niggling pain and I don't know if it's pain or what. I've stopped taking all my supplements because I was feeling a little bit dizzy, so I've stopped taking all them. That's kind of taken the dizziness away, and I'm just hoping that that is not a problem. So I'm trying to do everything. What I'm trying to do is get back to basics, take my body back to basics. Just me, no supplements, no nothing. So by the time I see my doctor, I can say, yes, I am feeling dizzy. No, I'm not feeling dizzy. I've stopped this, I've stopped that. And all I'm taking is my high cholesterol tablets, which I don't have. So I no longer have that. So I'm sat here now and I'm talking to you about this, and I'm already getting a pain here. Now, that is probably anxiety related. And, you know, it's a fact of life. I need to deal with those physical symptoms of anxiety. In the past, I've taken a drug called propranolol, and I don't want to go back on that because that made me feel quite nauseous, to be honest, and it lowered my blood pressure way too much. And my heart rate went right the way down, in some cases to 40 beats a minute, which is really ridiculous. So I don't want that again. Apart from that, as weeks go, it's been okay. I'm lucky, really, with Daryl because he puts up with my behaviour, my insecurities, or whatever you want to call it. You know, he looks out for me, and you know, he makes sure I'm okay. And yeah, we work well as a team. Although I must be getting on his nerves because I keep my health anxiety. I sort of offload on him sometimes, and he's saying, "Look, I don't have a health anxiety. You do not need to offload that on me. Just deal with it your health anxiety, and don't project it, because I do that, and I admit it, and I apologise." I'm hoping this week's a bit better, although, well, it should be. I've got to go to, as I said, doctors next week, so God knows what's going to happen there, and the dentist. So, you know, more anxiety. I don't actually get anxiety with the dentist, which is quite amazing, really, for me. But I do get it with the doctor, white coat syndrome. I did explain that in hospital as well, and she said, yeah. She said, you know, it shouldn't really bring on a murmur, but it's there. She said, I don't know. I said it's called a systolic murmur. It's between the S1 and S2. She said it's the least problematic area. And she said what it is, there's a dudum, that should be, and in between there's like a whooshing sound. She said, well, that's sort of the blood flowing. I guess abnormally. I don't know. I didn't really ask her. So, you know. Anyway, look, it's been great rambling on to you, and cheers for listening. And if I'm here next week, there will be another blog. So until then, ciao for now.